Good morning. I am Dr. Yogesh, Professor and HOD, Department of Physiology, Sri Chamundeshwari Medical College Hospital and Research Institute, Channapatna. And here we have our lab technician, Mr. Shivlingaya. So we thank him very much because he is going to be the subject for all the other experiments. We are going to learn a lot of things because he has agreed, and we can learn all the steps and let us not do any mistakes. In this video, we are going to see the examination of the abdomen. Okay. First thing is the areas. You have to know all the 9 areas of the abdomen. Here, let us concentrate on a few things. First is the palpation of the liver. Here, whenever you are examining the abdomen, first thing, the patient's leg should be in this particular position. You don't make the patient to just keep the leg straight like this. Okay, don't do like that. Take it up. Just okay. That will relax. Now, for palpation of the liver, what you do? You start in the right iliac region. You start in the right iliac region. Start palpating and start going slowly up. If you see my movement of my hand, it's just going like a wave like that. It is going. Okay, so continue feeling. From right iliac, go to the right lumbar, and you're going up to the right hypochondriac region. If at all, if the liver is enlarged, what will happen is, you can feel the liver will come and hit your hand. You're going to hit the lower margin of the liver. If you ask the patient to take a deep breath also, and when you press your hand, what happens when the person is taking a deep breath, the diaphragm is going to push the liver down, and it's going to come and hit this part of the area. Okay, and the liver also, if at all if it's enlarging, it will enlarge in this direction. So it's always good to start from here and go up. When you want to percuss the spleen, what will happen? Spleen, if it enlarges this way. So what we are doing, we are starting in the right iliac and we start going towards the spleen. So we are going this way. Okay. So start from the right iliac and feel and go to the opposite side. Most of the times you will not feel the spleen. Okay, one school of thought is you can support your hand trying to push the hand from that side, and in this side you are trying to push inside and feel for the spleen. Okay, this is also you can do it. Okay, next is for the kidney. For kidney you are doing a bimanual palpation. You're going to place one hand behind, one hand in the front in the lumbar area, and you're going to trying to hook the kidney from this hand is going to push from behind, and this hand is going to push from the top. So you're going to try to hook the kidney and feel for the kidney. These are the 3 important organs what we are going to feel in the abdomen. The other one is the fluid thrill and shifting dullness. In fluid thrill, where do we see when there is accumulation of fluid in the abdomen? Quite a good amount, maybe 1.5 to 2 liters. So in such case, what we do, we ask the person with one hand, he has to keep his hand like this. Can you keep it, sir? Okay. Keep it like this. You place on your hand on one side, on the opposite, the lumbar or the flank area. With the other hand here, just give a tap like that. Cameraman, come closer. If you give a tap like this, if at all the fluid is present, what is going to happen? The tap is going to create a wave of fluid, and that fluid will come and hit my opposite hand. So that is how we do the fluid thrill. Okay. Next is the shifting dullness. Name only is telling shifting dullness. So for shifting dullness, what do we do? See, all this will happen only when fluid is present. We are not going to see in any normal patient, but just know the procedure. You start percussing from the epigastric region. So wherever you percuss and go down, you are going to get a tympanic note. This is the tympanic note on the abdomen. So when the fluid is present, what will happen? In one particular area, you start getting the dull note. So wherever you get the dull note, what you do? You continue to percuss and go that side. Okay. Now I ask, now what will happen is, here everywhere I am getting dull note. I ask the person to turn towards me. So turn towards me, sir. Slowly turn this side. Full turn. So now if you observe, I never removed my hand. My hand was in same place. Now what was earlier, it was a dull note here. Now when I percuss, I will get a resonant note. What is the meaning of this? All the fluid has shifted down, whereas the bowel is floating up. So only this is called as what? Shifting dullness. Dullness has shifted down. Okay, so this is how we do shifting dullness. Okay, and so these are some of the important points what you have to know in the abdomen. Okay, thank you.